this is the second cervical vertebra, which is also called the axis. So we're looking superiorly, and this is the anterior side of the bone, and this is the posterior side of the bone. So we can see in the center, we have the vertebral foramen. This is where the spinal cord descends. And then on the more anterior side of the bone, on the left and on the right, we have these two large articular facets. So these are the superior articular facets for the first cervical vertebra. And then on the posterior portion, so this whole area here, so this is the neural arch of the vertebra. The most posterior point is this little projection of bone. This is the spinous process. And then on either side, just anteriorly to the spinous process, so on this side here, and then this portion of the bone here, this is called the lamina, or laminae is plural, so there's a lamina on each side. So this is just the part of the neural arch which connects the spinous process to the more sort of anterior part. So these bits here are the laminae. And then we have this portion of the neural arch, so a bit more anterior, so here and here, these are called the pedicles. So you have a pedicle on each side. So we have laminae and then pedicles. And the pedicles will typically join the neural arch to the body, but we don't have a typical body on the second cervical vertebra. If we tip it into this view, you can see a little bit better. So this is the body here, and then we've got this big sticky up bit of bone. So this is called the dens, or the odontoid peg, and this is where the first cervical vertebra articulates. So anteriorly we have this nice joint surface, and the first cervical vertebra will swing around that joint surface. So it's a pivot joint here. If we look at the inferior surface of the bone, so we can see the inferior surface of the body. We can see an inferior articular facet, one on each side, and these project anteriorly if you draw a line out from them, slightly anteriorly. And we can also see from this view that we have a little foramina on each side and a tiny little transverse process on each side as well, that are kind of hidden underneath the superior articular facets when we look from the top. So transverse process and transverse foramen for each side.